I'm going to be chairing this session on poverty, income and health, and I'm delighted to welcome Claire Thompson from the London School of Hygiene and Tropical Medicine, who's going to be our discussant today. So I think what we're going to do is 10 minutes per talk, because we're lucky we've got 5 speakers this afternoon, and then we'll have time for one or two questions after each talk, preferably questions of clarification. And then at the end, we'll hear from Claire, some thoughts from Claire, and then open it up to a wider discussion and questions. Okay, so the first speaker we've got today is Wagner Silva Ribeiro. He is an associate professor at the University of São Paulo, and he's also a researcher at the London School of Economics. And he's going to be talking to us about income inequality and mental health problems.
Good afternoon, everyone. So, in my talk today, I would like to share with you some ideas about the association between income inequality and mental disorders, and also a few ideas of what we should be done to tackle the deleterious effects of inequality on mental health. So I will start with a very brief global context around mental illness, morbidity, and impact, some very brief ideas or a very brief framework about causality in mental health, and some ideas on why inequality is so important as a risk factor for people developing mental disorders, and a little bit about the mechanism that would explain this relationship, and then some ideas on which direction we should be going to fight income inequality as an important driver of mental disorders. So, as a matter of context, we know nowadays that every year, more or less 1 in 5 people in the world will develop a mental disorder, and that in the lifetime, around 1/3 of people will have a mental health diagnosis. And there's plenty of evidence nowadays also showing that mental disorders are among the leading causes of disability. So as you can see here, from the 20 leading causes of years lived with disability, we have 6 mental disorders, being depression the second one in the list. And according to the Global Burden of Disease study, mental disorders account for more or less 21% of the total of years lived with disability. So the impact of mental disorders is huge everywhere. Well, what we know nowadays about the causality in mental disorders? Well, generally speaking, we know that mental disorders have a very complex causality. So if we should design something more or less like that, so there is lots of different risk factors in different dimensions which will kind of interact with each other, leading somebody to develop a mental disorders. And we know that among the most important, some of the most important risk factors for mental disorder are those that are considered social determinants of mental disorders. We know now that such social determinants, they act through the complete lifespan, and they will act differently and have different impacts across the lifespan. And we know also that they will act both in a more proximal level, so there are some more individual socioeconomic determinants, if you like, or socio-demographic, like age, ethnicity, exposure to trauma, distress, and so on. And we know also that there are a number of important social determinants that actually in a more contextual level. like community density, infrastructures of neighborhood deprivation, and one very important contextual risk factor is exactly economic inequality or income inequality, as it is also known. And so last year, for example, we published a systematic review in which we looked at the association between income inequality and the prevalence and incidence of mental disorders. We really found here in our meta-analysis that there is an association between income inequality and any mental health problems in the studies we included in our meta-analysis. And the association was even higher with depression. And here, even though the effect size, they are quite small, from a population point of view, they are not negligible. And also, we suspect that if the quality of the studies was better, the effect size would be even bigger, showing that really there is a very important association between inequality and mental disorders. And so, what exactly do it means income inequality? It looks more or less like that, You have a few people which have a lot, probably much more than they need. For example, here is a neighborhood in São Paulo where I come from. So as you can see here in this building, we have a swimming pool in each apartment. And that's real, that's not a Photoshop something. Just across the wall, we have a huge favela, a huge shunt compound where very poor people live. So that's what income inequality means. And why is inequality so important? Basically because the literature shows nowadays that most of negative outcomes we can think about, like for example, this is the index of health and social problems, and here the income inequality. As you can see, the higher the inequality, the higher the proportion of people with health and social problems. And the same patterns have been found to violence, distress, fear, status competition, stigma and discrimination, and whatever negative outcome you name it, probably will be in that list. And interestingly, this other graph shows UNICEF index of child well-being, and again, income inequality. So the higher the inequality, the lower the well-being. And the same pattern has been found to relate in relation to social capital, trust, social mobility, social cohesion, civic participation, and etc. That means whatever positive outcome you name will be in that list. So if we start thinking about the role of income inequality in the causality chain of mental disorders, it would look something more or less like that. As you can see, through different pathways. So for example, income inequality will increase status competition, which may increase violence, conflict, crime, may increase distress, lack of social cohesion, and so on. And all of that is related to, will increase the risk of developing mental disorders. So income inequality increases lack of social cohesion, which increases social anxiety, which is related to common mental disorder as well, and so on. So what should then be done in relation to income inequality? So if you are going to start thinking about interventions, so there are things that need to be done in a wider society level, in a more contextual level, and coming all the way through the individual. Well, the ultimate goal actually would be to reach economic equality, to reduce income inequality, because it would lead to more social justice, more sustainability, enriched social life, and so on, improving well-being. From a health system perspective, it's very important that particularly the mental health facilities, mental health professionals are integrated into the community, helping to promote well-being beyond just treating people with mental disorders, which is very important as well, but we should aim at promoting well-being and so on. And from an individual level point of view, it's very important to invest in interventions that can empower people. So psychological interventions that can improve self-esteem, self-efficacy, and things like that are very important to be considered from an individual point of view. So that's my message. So I just would like to finish with a quote from Richard Wilkinson and Kate Piquet, who are some of the most important experts in epidemiology of inequality. So that's the quote. So thank you very much for your attention. And that's it.
Yeah. Okay, thank you very much. Does anyone have any questions for Dr. Silva Ribeiro? Just points of clarification or quick questions? Yeah. Oh, if you just wait for the mic, it's coming.
Just basically, from this, we basically, most probably the best thing to do is to actually have a school class on social, what do you call it? Any kind of social something. Well, basically they will understand about disabilities and how homelessness and first aid and so on. It's like social studies or something like that. From basically early on up to the age of 14 or 15. And then the country becomes a more caring country, then we'll have less of these kind of problems.
Okay, thank you for your comment. Would you like to?
I think I still got the microphone. So, well, from a so if we think specifically about childhood, I think something that's very important is to try and provide everybody with equality of opportunity. So we have to improve the life conditions of the children all the way through society.
Yeah, basically what I'm saying is through studies they will learn the problem of disabilities and people with financial problems and so who are not earning enough, you know, but like people who are paid under the national wage, okay, and they will understand and they'll come out and help. But if basically England had to come back to that caring kind of time, where when the NHS was actually formed, you know, a few years after it, they actually were quite caring, and now they're gone.
Yeah, thank you. I think we're going to come back to this actually, because some of the speakers we've got later on are going to be talking about some interventions in the community to address some of these issues. So I think they might touch on the points that you've raised. So if it's okay, I think we might move on to the next speaker, just because we've got limited time and lots of speakers, which we're lucky to have. So do you want to come up We've got Dr. Laura Goodwin now, who's the lecturer in epidemiology at the University of Liverpool, and she's going to be talking about social patterning of alcohol use.